Rhode Island Attorney General Peter Neronha has released his report into the state's hospitals' handling of vaccine distribution in the early days of the rollout, specifically their decision to vaccinate board members.
Now, the report found the state's two largest hospital groups did not violate any laws, but AG Neronha concluded Care New England and Lifespan, quote, should have acted differently. 12 News reporter Anita Buffoni spoke to the Attorney General about his findings, and she joins us now with what he and the hospital groups are saying tonight. Anita?
Mike and Shannon, the Attorney General said the hospital groups didn't violate any regulations because the Rhode Island Department of Health hadn't established clear guidelines for how the vaccine should be distributed, but he criticized their decision to offer vaccines to board members.
I think it was a significant error in judgment.
After it emerged in January, the state's top hospital groups, Lifespan and Care New England, offered COVID-19 vaccines to board members and administrators who didn't interact with patients. The Rhode Island Attorney General launched a review of vaccine rollout protocols. Because the health department didn't lay out clear enough guidelines to hospitals as to how the vaccines should be distributed, Neronha found no violations occurred. But the Attorney General, who doubles as the state's healthcare advocate, said their decision erodes public confidence in the vaccine process.
In my view, it wasn't right to offer vaccination to board members before everyday Rhode Islanders were given the opportunity consistent with Rhode Island Department of Health guidelines at the time.
The hospital groups insisted they did not cut the line and argued they followed health department guidance. In a statement, Lifespan's CEO said in part, "We have been committed to the equitable and efficient distribution of vaccines from the very beginning of the statewide vaccination program. We acknowledge, along with the Attorney General, the importance of public perception and holding ourselves to the very highest of standards." The health department says they will make changes moving forward.
We've learned from that experience, and I think as we give out future guidance, we'll have to put in more specificity.
Now, the hospitals made this move to vaccinate board members at a time when the vaccine was unavailable to anyone outside of hospital workers and nursing home residents. Care New England issued a statement saying they're pleased the AG concluded they didn't violate any rules. I'm Anita Buffoni, 12 News.
Meantime, Rhode Island's Attorney General has released his report on whether the state's largest hospital groups broke the rules during the early days of the vaccine rollout.
His conclusion, Lifespan and Care New England did not do anything illegal, but they did make mistakes. 12 News reporter Anita Buffoni explains the findings and has reaction. Anita?
Mike and Shannon, this stems back to January when the two top hospital groups offered COVID-19 vaccines to board members and administrators who didn't interact with patients. Ultimately, it was the lack of guidance on vaccine distribution from the Department of Health that cleared Care New England and Lifespan. The Rhode Island Attorney General found Care New England and Lifespan didn't violate any vaccine rollout regulations, but did have sharp criticism for their actions.
I think their board members should have been treated like everybody else in Rhode Island.
The two hospital groups offered the COVID-19 vaccine in January to board members and administrators at a time when the shot was unavailable to anyone outside of frontline workers and nursing home residents. AG Neronha, who doubles as the state's healthcare advocate, explained their decision eroded the public's trust, sending a signal that the playing field is not level, even if no laws or violations were broken.
When you're left with that situation, as I am, where you know that the conduct, or you believe strongly that the conduct was wrong, that you need to say it, whether or not there's a case you can bring forward. The law doesn't reach all conduct that is bad.
The hospital groups argued they did not cut the line and were following guidance by the Department of Health. Lifespan's CEO issued a statement saying, in part, "We acknowledge, along with the Attorney General, the importance of public perception and holding ourselves to the very highest of standards. We remain dedicated to do all we can to bring the victims of COVID-19 back to health, to get vaccines into arms, and to stop the spread of the virus." Now, the Department of Health told 12 News they will put out more specific guidance in the future. Care New England said they are pleased the AG concluded they didn't violate any rules. I'm Anita Buffoni, 12 News.